We are going to look upon biomodified collagen-based nanobiocomposite for the treatment of breast cancer. As you all know, cancer is an abnormal condition of uncontrolled cell division. According to our World Health Organization, 35% of the females have been affected with breast cancer. Though there are various treatments available, they are not up to the level. There have been side effects and cancer may occur again. So now we are going to introduce a new approach of nanoparticle based drug delivery system. We have developed a nanobiocomposite which involves nanoparticle for the treatment of breast cancer cells. We have analyzed, tested and proposed a new methodology to treatment of the cancer cell. Our aim is to prepare a multifunctional nanobiocomposite containing copper oxide nanoparticle, collagen and anti-cancer drug for the treatment of breast cancer. It's a 4-stage process. First, a synthesis of copper oxide nanoparticles. Copper oxide nanoparticle acts as a carrier material to take the drug to the targeted site. And collagen acts as a binding material between the copper oxide and the drug. Collagen is extracted from the fish scales, which is more biocompatible. Camptothecin is a breast cancer drug, anti-cancer drug for the treatment of breast cancer cell. Finally, we tested and developed nanobiocomposite using the MPT assay. This is the synthesis process of copper oxide nanoparticle. 0.5 molar of copper sulfate pentahydrate solution is prepared and 0.5 molar of sodium hydroxide solution is prepared. Both 125 ml is taken and mixed with the help of the magnetic stirrer. With a less amount of heat, finally a precipitate is formed. This precipitate is finally filtered and dried, which is copper oxide. This is a diagrammatic representation of copper oxide. Two images. This is the copper oxide pentahydrate, sodium hydroxide, and finally the copper oxide is obtained. This is the characterization of copper oxide nanoparticle. The graph is plot. We have characterized the copper oxide nanoparticle with the help of the UV spectroscopy. A graph is plotted between absorbance and wavelength. We have obtained a peak at 214 nanometer, which proves that a copper oxide nanoparticle size is less than 100 nanometer. Our next characterization is XRD analysis. This is the image of the XRD analysis. We have obtained two peaks, and we have calculated the size based upon the peak, which we obtained is about 20 nanometer. This is the same image of copper oxide nanoparticle. Here it is clearly mentioned that the obtained nanoparticle is size of 97 nanometer. So it is confirmed that the nanoparticle is of floral shape and size varies between 20 to 100 nanometer. Next is the collagen. This is the extraction process of collagen. Initially, collagen fish scales are collected, washed, cleaned and dried, and chemical treatment is done using NaCl, EDTA and acetic acid, 3 with 0.5 molarity. NaCl is for removing impurities, EDTA is to smoothen the scales, and acetic acid to remove the insoluble part. The treated scales are grinded and centrifuged, and supernatant is collected, which is nothing but the collagen. This is the image of extracted collagen. For 80 grams of dried fish scales, we obtain 50 ml of collagen. This is a Lowry's test to test that the obtained collagen contains protein. A change of color from pale white to blue proves that the given sample contains protein. Another test, Ninhadin test. It is also a protein confirmation test. A change of color from pale white to violet proves that the given sample contains protein. This is the SGS page of isolated collagen. With the help of this SGS page, we have proved that the obtained collagen is of triple helix structure. Beta is of 135 kilodalton, alpha 1 is of 65 kilodalton, and alpha 2 is of 28 kilodalton. And finally, the molecular weight is 300 kilodalton. This is a smooth surface morphology of collagen with the help of the SEM. We can see a fine bundle of collagen fibers in this SEM image. This is the drug which we are going to use to treat the cancer cell. This drug is overlaid upon nanobiocomposite, that is copper and collagen, which is given to the breast cancer cells for the treatment. This is the developed nanobiocomposite. It contains copper oxide nanoparticles, collagen, and anti-cancer drug with 3 proportions, and which is tested upon HS578T breast cancer cell lines. Final test. Percentage of cell viability on different concentration. A different concentration of developed nanobiocomposite is taken, that is 20, 40, 60, 80 and 100. Upon each concentration, different values of cell viability, percentage of cell viability has been obtained. This increase upon concentration, decreasing the cell viability, proves that the developed nanobiocomposite is effective in treatment of breast cancer cells. This is the graph just plotted between the cell viability and concentration. You can clearly see that the increase upon concentration will decrease the cell viability. This is the image. Upon various concentration, finally the breast cancer cells have been killed. On different concentration, different images have been taken. This is the microscopic images which you are seeing. Our final conclusion is obtained copper oxide nanoparticle is analyzed, synthesized with the help of UV specs with absorption at 240 nanometer, and also analyzed using SEM and XRD, which proves the sizes of between 20 to 100 nanometer. Extracted collagen is characterized using Lowry's test, Nanoparticle test, SDS pitch, and which proved it is a type 1 collagen with molecular weight of 300 kilodalton. Finally, the developed nanobiocomposite analyzed using MTT assay, which proved a decrease in cell viability upon increase in concentration. These are references. Thank you.